Good morning, students. Today we will see about the technique of writing the review of literature. The review of literature is the essential element in doing the basic research work or any research work you are doing. As a students, also everyone you need to know when you select the topic. Also, you need what topic they are doing. You have to go for review of literature, or suddenly you are getting an idea that you have to do research. That also you have to do review of literature. In this research you selected and you want to write a design you want to select. So you want to see again review what all the design they have used for that and the tools data collection. You need to do the extensive review of literature for the record writing until you publish or anything. You have to do the review of literature. Are you understanding? So without review of literature, this one, but in a chapter you will be writing, for example, CKD patients, I have taken it. So review of literature is one of the chapter also. So when you read review of literature, you will be searching in the most search engines like Google, PubMed, everywhere you will be searching. So you'll be typing the keywords like chronic kidney diseases or the psychological impact of whatever maybe your thought, your statement or problem, you type it. So many will be coming, you will be filtering it, right or not? The related article, you collect those articles and put it in the file first. Are you understanding? So only thousand or 5,000, 6,000 coming, you filter it, filter and collect it which is relevant to you. Maybe you have collected 30 articles, then you sit another, take 10 minutes rest, you take it and analyze. You just read the abstract which is relevant to you. You think that this article is okay, good, I am going to write. Once you are going to write it, you have to remember some strategies in your mind. What is that? First one, you have to remember what is the author, how many author has done it. So you take the first author, use his second name, surname should be, I am a Helen Mariadas, so you have to write it Mariadas, H will be my name. If I have done, Helen Mariadas has done with many other author, you can write it as a et al. You have to know what is the year. Mostly your researches, the recent year studies will be more helpful to write the code it, right? And you can see what is the study design they have used, sample size, where they have done, what is the method of data collection and the results. So these are the things and the key points you have to see in the review of literature. Hope you understand. Next, we will read it here. Keeping that in our mind. Cross-sectional study, 183 patients. What is the scale they have used? This is a area, a multinational study they have done among the undergoing hemodialysis. So it's suitable for you. The result is here. So how we have written? He has written here. This is the year. Not only it's a compulsory that only year, either the study conducted by Brito, you can write it also among with the how many patients and what are all the nations and what the scale they have used. Are you understanding? Depression inventory scale and what are all the results revealed. What it is saying, the results scores, what it is showing is repeated infections, edema, all these things, low adherence result, low using adherence results leads to the in out of 10 out of 20 dimension evaluated and depression, all except with the patient satisfaction. So what are all the dimensions, how they are using it. So this is how we will see the another example, you will be understanding better. So here we have taken another research. It is the quality of life of the people with the spectrum of CKD patients. First you take a pen, you underline it. What is the method, how many participants with the, what is the analysis they have done and what is the results. So how you can write it. And one more thing, every time when you write it and down, you can write the bibliography, I mean reference, you can write it with the DOI number. For example, sometimes you have missed some of the categories, so that immediately you can go to DOI number and search, and you can reduce or extensive. Your teachers a little more deeper, you can write the result we want, it's more detail, you can add it up. Are you understanding? So what they have done, it is there. What is the scale, quality of life scale, you see pain, self-care, anxiety, mobility, depression, all these things. What is the method they have used? Multivariate linear regression model, right or not? The result is saying very quality of life with a 95% of confidence interval, saying comparatively anxiety, depressions are really affecting their life. Like that you have to write and immediately. Are you understanding? So each and every paper, this actually I wrote it in the handwriting, but the handwriting will not be understood by you, so I typed it and show you. First you take it one paper and write it. Single paper also should not be wasted. You should be file it in carefully. Are you understanding? So anytime you may have a doubt, you yourself will be missing some of the dimensions, maybe the study designs or anything you are missing. Again you can go to the this search engine, you can put this the DOI number, you can get back the study. Okay, one more example we'll see, so there will be more clarity. I take abstract. The abstract is clearly telling about, it's a narrative review, right? CKD patients only, psychological impact. The data were collected, the period is there. So you take a pen, mark it, all the designs, methods, whom, period, what is the keywords they have used. Narrative review, no? So there is a period, what is the keyword, search engine they have used it. All these things, and who are all undergoing this one. Then here concluded, what is the results, what is this is the complexity. So nurses has to understand the intervention, supportive care for them to prevent the psychological problem. So you read it, you take 10 minutes or 5 minutes time, read it under this category, then you can write it. Many has done. So written the surname, conductor, narrative review, literature review based on the previous studies, right or not? Search engine they have used this much. The key, okay. What is the keywords they have used? The data collections was done, period they have written. The keyword used are hemodialysis, failure, psychological disorder. These are all the things they have. The review results revealed that the patient CKD undergoing hemodialysis or ignore negative impact of their quality of life. Thus, the researcher is telling that the awareness of CKD lacking among the physicians and general public health, because the worldwide burden is increasing.